The holiday season can be a time of joy and excitement for many people, but according to a survey conducted by the health and wellness website Very Well Mind, 26% of Americans are concerned about managing their mental health during the holidays this year. 19% said they were worried about managing the mental health of loved ones. For more, I want to bring in Dr. Jessi Gold. She is a psychiatrist and assistant professor in the Department of Psychiatry at Washington University in St. Louis. Dr. Gold, welcome. Thanks very much for joining us. You know, this can be a really tough time of year for a lot of people, those who've experienced loss especially. What are some reasons the holidays can take such a toll on mental health?
Yeah, I mean, this time of year has traditionally been hard for people. It's a time when you could ask therapists and psychiatrists. We've always been quite busy in the winter time and in the holiday season. So before COVID, you know, it's a time where people tend to gather as a family, and with family brings family stressors, which, you know, can be that you don't get along with your family. It could mean that you don't have somewhere to go and everyone else is going with their families. Or in this season, it could be a grief gathering when, you know, usually you do gather with family and that family member is not there anymore. A lot of people have lost loved ones. A lot of children have lost parents. This is a big season for that. On top of that, it's dark at 4 p.m. right now, and most people like sunshine. The winter weather makes it harder emotionally for people too. And then there's just like an added stressor of trying to kind of do everything you want to be doing in this time, and then you throw on a new variant. So I think there are a lot of things on people's mind that are contributing to their mental health right now.
Yeah, this is now our second holiday season living through the coronavirus pandemic. What have you been hearing from patients as they try to navigate this ongoing health crisis?
I think people are sad and a little disappointed, you know. I think that they are looking forward to having a different kind of holiday season this season, and unfortunately, it's looking like it's going to be more like last holiday season, and it feels like there are things that they had planned that might have to be canceled, or flights that can't happen, or vacations that can't happen, and I think that that's really hard on people and anxiety provoking. I know that I have some parents of people with chronic illness, and that makes it even harder because you don't want to put your kids at risk, or, you know, parents of kids who aren't yet vaccinated and have the same risk there, and so they don't want to be putting their kids at risk. And those decisions are really hard and weigh on you when you're trying to decide, you know, how you're going to spend your holidays and how that's going to lead to family arguments or not, and that just contributes to more stress, I think.
It's just a constellation of factors, doctor. I mean, how can people manage their mental health and stress during the holiday season and beyond?
You know, it's really hard. I think we have to really try to focus as much on the things we can control. COVID especially has been this big, big unknown for us the whole time, and throws in a lot of uncertainty into everything that we're doing. And so when we try to make plans and when we try to do things, it's like we can't because COVID's here, and that's really hard. And so it's really important to try to focus on what you can control, try to find some things that you know you can have happen, you know, some activities with your family that won't get canceled that you can look forward to, because, you know, it's important to have things to look forward to, especially during this holiday season. If you're a person who doesn't like the dark, try to get out when it's still light during the day. I think that's really important. We spend a lot of time indoors, so if you can even take a 5-minute break sometime during the day to go outside while it's still light outside, that can be really helpful for people. You know, exercise and also be really helpful for that with the light and the darkness, because you get really kind of set on a schedule that way, and it makes it easier for you to get up in the morning and go to sleep at night. So all of those things can definitely be helpful, but ultimately it's just acknowledging that it makes sense that this is hard, and it's been hard for all of us, and to say that it's not hard would be lying, you know?
Yeah, you know, doctor, I'm curious. I wonder if you can talk a bit more about that, because, you know, if you were to say scroll on social media for any amount of time, you'll see people on there taking trips and going to faraway, wonderful locales this holiday season and enjoying themselves, and certainly seeming to, you know, have a good time, at least according to their social media accounts. But what I hear you saying is that, you know, the reality for most people is quite different, and that's normal. That is what the human experience is at this particular moment in time.
Absolutely. I think social media is really hard because people like to show the most fun thing that they're doing and not the thing where they're sitting at home. And so, you're going to see the people going on trips there, or those are going to stick out to you because you most want to be doing that and you're not doing that. So if it makes you angry, try to get off social, give yourself a break from social media, remind yourself why you're doing what you're doing and why you make the choices that you're making. Different people make different choices aligning with their values, and you can't control everybody. You can only control yourself. So I think it's helpful to think about why you make choices, have conversations with your friends and family about that if it's helpful. Try to really agree with what you're doing and notice that you're doing what you think is right for you, and that's okay. It doesn't mean that something's wrong with you or you're being too harsh on yourself. You're just trying to protect yourself and your family.
Finally, doctor, not everyone who is struggling reaches out for help. Are there signs that people should be aware of if, say, they are gathering with loved ones this time of year? And I'm thinking of young adults and teens especially who might be hesitant to talk about any mental health challenges that they might be experiencing.
Yeah, big signs of changes would be any sort of behavior change. So your person's usually quite outgoing and they're not anymore. You ask them to do things and they don't want to do it anymore. You've noticed that they're not sleeping, or they're sleeping too much, or their eating habits have changed. Sometimes that's pretty easy to recognize. They're not interested in things they used to be interested in. It's really important just to check in with your kids and say, how are you doing? I just wanted to know, and I was worried about you. Or, I noticed that this holiday has been really hard for everybody, and I just wanted you to know I'm here. And I think it's helpful just to open that door, because kids don't always know they can go to their parents, even though you think that they do. And so, telling them that you've had struggles before too, or that this has been hard for you too, especially when things get canceled, I think makes it more equal and makes it easier for them to say, okay, I can go talk to you because you're struggling too. And it's not just in my head and I'm this angry teenager who can't deal with anything.
Right. No, it's important to normalize, is what I hear you saying, these kinds of discussions of these feelings, as difficult or as uncomfortable as they might be. All right, Dr. Jessi Gold. Doctor, thanks so much for sharing your insight and expertise with us.
Of course. Thank you so much for having me.